Hi everyone, I am Davide Piaggio and I'm a PhD student in biomedical engineering. My supervisor is Professor Leandro Pecchia, and we were kindly invited by Professor Caglialvizzi, whom I would like to thank, to give a talk about the role of biomedical engineers during COVID-19 for a seminar that will take place at the Agni College of Technology. This talk will be divided in two parts. In the first part, I will be giving an overview of what is the present and future role of biomedical engineers for COVID-19. And then my colleague Alessia Maccaro, who is a bioethicist, will give you an overview of what are the ethical responsibilities and what is the ethics that should be followed by biomedical engineers and scientists nowadays. But let's start from the start. As I said, I'm a biomedical engineer doing my PhD at the University of Warwick, which is in England, in the West Midlands, exactly in Coventry. And my working group is the Applied Biomedical Signal Processing Intelligent Health Lab, ABSPI. And my group has different focuses. One focus is artificial intelligence and Internet of Things and big data. And in this subgroup, we are studying how can we improve the life of the elderly, how can we study stress, how can we study the prevention of falls with artificial intelligence. Then we have a group studying on the global health and global sustainable development goals, which is more related to my PhD topic. In fact, we research about the design of medical devices that are resilient for low resource settings, for example, Africa. And we also focus on the regulations and standards, researching on how they should be changed to be more inclusive of different kinds of settings, not only high resource settings like countries like the UK, but settings that are with less resources and less personal expertise and many other characteristics. And then there is another part focusing on the management and assessment of health technologies. But what is a biomedical engineer? Well, biomedical engineering is a very broad field. In fact, a biomedical engineer could be someone designing medical devices. A biomedical engineer could be someone working in the field of regulations and standards for the safety and efficacy and efficiency of medical devices. It could also be someone working in the field of biomechanics, so studying the analysis of movement or designing prosthetics. It could be someone with a bioelectronics background, designing, for example, pacemakers. It could be someone working in a hospital. It could be a clinical engineer working in maintaining and managing the health technologies within a hospital. And finally, someone working with bio-nanotechnologies. But this is a very broad field. Of course, there are many other applications of biomedical engineering which I didn't mention. Now, as there are many roles for biomedical engineers, as biomedical engineers work in different fields, with great power comes great responsibility, as Spider-Man said, but this actually is a message that comes from a French document in which they say that they must contemplate that the great responsibility is the inseparable result of a great power. So this means that it's true that biomedical engineers have a lot of power because they have the expertise in many different fields, but related to this power, there is also a great responsibility. And this is what we will see in the next slides. Of course, there are many roles that are related to COVID-19 that biomedical engineers could help with. For example, they could help develop new guidelines and policies on the resource allocation of the medical devices when there are not enough medical devices and there are too many patients. They could be counselors to the government for developing strategies for controlling the pandemic. They could help design and test protective equipment, personal protective equipment, for example, respirators, face shields. They could help test and develop and design novel essential medical devices like ventilators. They could help create, design rapid testing kits to screen who is sick from who is not. They could help develop vaccine and drugs and to perform drugs trials in a correct way for COVID-19. And of course, they could help with their expertise on e-health and health for example, telemonitoring, remote monitoring of sick patients for limiting contagion, or with creating apps for contact tracing apps for tracing who has been in contact with whom and who is sick and who is not to control the pandemic. And many other roles, really. There are many other roles of COVID in which biomedical engineers could help with COVID-19. Of course, with COVID-19, there are many surfacing or resurfacing issues that were already known to biomedical engineers and bioethicists that are resurfacing right now. One is the responsibilities of science and technology. Another one is the inadequacy of regulation and norms, which lack universality. We will go through these points in the next slides. Then there is the dilemma of what are the correct criteria for the allocation of medical devices in times of crisis and need, and the dilemma of data protection and privacy. And we can start from the responsibilities of science and technology. I decided to give this title Responsible Thinking, Responsible Actions, and Responsible Silence because COVID-19 created a global lack of essential medical devices like ventilators and of personal protective equipments like respirators or masks. So many people felt entitled to give their own opinion about possible solutions. Many do-it-yourself solutions were released on the web or on social media or on any kind of media, although they came from people without expertise. Now, even if these ideas were given with good intent in mind, they for sure they could potentially be more harmful than good. Why? Because in order to design and develop a medical device, but also personal protective equipment, you need postgraduate education, you need a lot of years of experience, and you need to follow international standards and regulations so that you can test and be sure that your device is safe and efficient to use. Now, all these do-it-yourself solutions weren't for sure following this. For example, it was showing on the slide the funny image of different kinds of masks, but I've heard people saying that you could use Hoover filters as a mask, and actually this could be dangerous because it has been studied that some Hoover filters contain fibers of glass, and this could be harmful for the health. And also other people saying that you could 3D print respirators using as a filter only cotton. For sure, these are fake claims, so it's important to be able to distinguish what's good and what's not, and to always follow the best evidence given by the medicine and international standards and regulations. A similar scenario could be applied for ventilators, and in fact there were many cases in which a lot of inapt ventilators were designed, and this is testified by some of the newspapers that are showing on the slide. For example, this is from France, showing that over 8,000 respirators were produced for nothing. Why? Because they were too essential and they were not good enough for treating patients with COVID-19. Then UK cancels orders for simple ventilators, needs more complex ones. And then there is a good example from Italy, for example, where the SIARE, with the help of Fiat, which is what now is FCA, and the Ferrari and the Italian government, so with this joint action, they were able to increase the production of SIARE, which is the producer of ventilators in Italy, And this was actually a good example because uniting engineers from different companies, so Ferrari, FCA, and with the joint action of the Italian government, Italy and Ciare was able to increase the ventilation production by 50%, if I'm not wrong. And I leave you with this open question, which Alessia will talk about. And the question is, are we sure that amateur solutions, so do-it-yourself solutions, are better than nothing? This comes from the fact that I've heard many people saying that some solutions, even if they're not up to the standards or if they're not tested and they're a bit amateur, they're still better than nothing. But is it true that it's better than nothing? The other problem that was highlighted by COVID-19 is the inadequacy of regulation and norms. In fact, COVID-19 has created a generalized situation of low resource settings, which is usually a setting characterized by the lack of means, lack of funds, lack of expertise, lack of personnel, and so many other characteristics. Usually this kind of setting can be found in poor countries, for example, in sub-Saharan Africa. But COVID-19 is a disease that put every state at the same level. And also high resource settings like Europe, Japan, or the USA found themselves in very difficult situations because of the lack of PPE, the lack of sanitizing gel, or of essential medical devices like ventilators or ICU beds. And there was already a failure in the system of the regulatory framework. Why? Because, for example, the medical devices regulations are too strict and too general, and they are very difficult. The requirements are too strict for low resource settings, which by nature will never meet the ideal world that is depicted in these regulations. For these reasons, our research group is trying to highlight this problem and see, for example, what kind of design criteria should be taken into consideration for a medical device to be resilient to low resource settings. And in particular, COVID-19 highlighted the inadequacy of the regulation and norms regarding, for example, the PPE standards. Why? Because the PPE standards are very general and too generalistic. In fact, PPE, as you may know, can be used for the different activities, even in industrial activities, carpentry, soldering, painting, and many others. This means that these kind of activities sometimes have very specific tasks and very hazardous tasks that are not at all correlated with COVID-19. For example, in soldering, your site may be harmed by the luminous radiation, so you have to have a certain filter in the face shield for this kind of radiation, and so on. Since these standards cover all the possible application of PPE, all the tests that are required are very broad. This means that when it comes to a pandemic and you need to use the PPE for a certain application which is not as for which some tests are not useful, you still have to do these tests because the regulations say that you have to go through these kind of tests, and this delays the answer of the government and the hospitals, and this of course kills many people. We spoke about this problem in this paper, which is by myself, Dr. Pecchia, Maccaro, Forbisano e Iadanza, published on Health and Technology. You can find it on Health and Technology, and it's open access. Another problem that COVID-19 has highlighted is the dilemma of resource allocation. So what is the right way and why, based on what criteria you should allocate resources that are scarce? I will just ask you a question. In case there were only one ventilator available and two people needing it, one being a 75-year-old person and one being a 35-year-old person, who should be prioritized and based on what criteria and why? If you ask an health economist, he will say to use the QALY, which is the quality adjusted life years. Usually it's a measure used in economic evaluations to assess which is the value of a medical intervention. In particular, one QALY equates to 1 year in perfect health, or for example to 2 years at 50% of the health. So it is clear that you could use QALY to compare what would be the outcome and what would be the gain on the 75-year-old man and on the 35-year-old man. Well, for example, if the 75-year-old man had some pre-existing conditions, for example, limited mobility, let's say that the intervention would give him 10 more years of life, but it wouldn't be a life at full quality because he already had limited mobility. Let's say that his life would be at 50% quality. This means that 10 years at 50% quality equals 5 QALY. On the other hand, if you have a 35-year-old man who is young and healthy, and let's say that he would live up to 85 years old, so he would gain with the surviving COVID 50 more years of life, his life would be at 100% quality. This means 50 QALY. Of course, based on following this kind of reasoning, a 35-year-old man would gain much more, not only himself, but he would also be able to give back more to the state because he's pure workforce compared to the 75-year-old man. Are we sure that this is ethically acceptable? Another issue related to COVID-19 is that of data protection and privacy, as testified by the paper by Sulmasi, which is entitled "Should the Institution Disclose the Names of Employees with COVID-19?" Now, imagine that you are an employer and that one of your employees tests positive for COVID-19. For sure, you will need to notify all your employees. But should you only be saying that one of them has tested positive for COVID, or should you also reveal the identity so that they will know who has been more in contact with this person? So, to what point breaching someone's privacy, personal privacy, is allowed for the benefit of society? This is an ethical question. Another ethical question regarding data protection regards contact tracing apps, which are a very hot topic right now because they seem the way out of the pandemic. Contact tracing apps are apps that are used for tracing whoever comes in contact with you, in order so that in case they test positive or you test positive for COVID-19, you or them will be notified. What are the benefits of this? The benefit is, for example, economical or psychological. Why? Because there will not be probably anymore a need for blanket lockdowns, but there could be a more specific targeting and quarantining of people who are at major risk of COVID-19 because they've been in contact with someone else who had COVID-19. And this will be of a less economic and psychological impact on the society. Again, a positive example comes from an app developed in Italy, which is Immuni. Because in this case, Immuni doesn't use geolocalization and doesn't store any sensible or personal information. It just relies on Bluetooth. And all the data will be deleted after the pandemic will be over. Thank you for your attention. I will now leave the floor to Dr. Maccaro.
Hello everyone, thank you for hosting us today. I would like to deepen the issue of the relationship between ethics and biomedical engineering, in particular during the COVID-19 Starting from this question, what is the role of ethics in biomedical engineering? Is it just an additional embellishment of science and engineering? In fact, the value of interdisciplinarity is increasingly recognized as the trailblazer for the future step of science and technology. As can be read in the ethical codes of the biomedical engineer, ethics is linked to professional obligation, healthcare obligation, research obligation, and also training obligation. About biomedical engineering professional obligation, it's true that biomedical engineers, in the fulfillment of their professional engineering duties, shall use their knowledge, skills and abilities to enhance the safety, health and welfare of the public. Strive by action, example and influence to increase the competence, prestige and honor of the biomedical engineering profession. About biomedical engineering healthcare obligation, it's true that biomedical engineers are involved in healthcare, so their activities shall trigger responsibility toward and rights of patients, including those of confidentiality, privacy are the primary concern. Consider the larger consequences of their work in regard to cost, availability, and delivery of healthcare. Biomedical engineer research obligation. Biomedical engineers involved in research shall comply fully with legal, ethical, institutional, governmental and other applicable research guidelines, respecting the rights and exercising the responsibilities to colleagues, human and animal subjects, and scientific and general public, and publish and or present properly credited results of research accurately and clearly. Biomedical training obligation. Biomedical engineers entrusted with the responsibility of training others shall honor the responsibility not only to train biomedical engineers students in proper professional conduct in performing research and publishing results, but also to model such conduct before them, and keep training methods and content free from inappropriate influence from special interests. During COVID-19, the role of the biomedical engineer has emerged, and this indispensability has become increasingly clear, and the ethical issue has become even more relevant. One theme, among many others, has polarized the ethical debate about biomedical engineering can be included in this question. In the absence of equipment, how to consider the use of tools built and tested for a different intended use? On the one hand, there is the answer of utilitarianism, which asks, it is better to consider the contingent utility. This could maximize the risks, but what about benefits? It is not known, in fact, if an instrument tested for another use can actually be used for the current purpose. On the other hand, there is the current of the so-called substantialism. The purpose of the tool must be respected. This perspective contains risks and also possible benefits. In the end, we can leave ourselves with an ethical reflection on the following question. What is the limit within which we can say better than nothing? To what extent can the biomedical engineer make decisions that can put a person's life at risk in order to have a prompt but probably unsafe response with a view to better than nothing? Thank you very much for your attention.